I'd just like to acknowledge the traditional custodians of the lands in which we meet today and pay our respects to elders past, present and emerging. And also I would just like to welcome everybody to this webinar and welcome to any external providers that are joining us today and also our internal teams. I will now hand you over to the National Digital Health Agency to deliver the webinar on Provider Connect Australia. Thank you.
Thanks, Jennifer. While I get my slideshow set up, my name's Cheryl Hughes. I'm responsible for the allied health and digital adoption support section over here at the agency. And part of that work is around Provider Connect Australia. We've got Tracy McGregor here also. If Tracy, you want to give a bit of a wave. Tracy has actually just started with us a couple of weeks ago and she will be our project manager for Provider Connect Australia. And so this is one of her first couple of webinars to do. And we've also got Peter Rolanitis with us here today. So he actually works day in and day out answering phone calls and questions around Provider Connect Australia. And so he will be able to answer any questions that you have on how to actually use the product. And he will go through a bit of a demonstration on that in the second half of this meeting. So I'm actually going to start with a bit more of a formal presentation around, what Provider Connect Australia is and the problem that it's trying to solve and why we think it's, quite valuable both to the PHN network but also to healthcare organisations and healthcare professionals. Provider Connect Australia, we call it PCA for short because we all love good acronyms, but it really is about connecting providers with their business partners. So, we know from talking with practice managers, with various clinics, with other healthcare organisations, pharmacies, that when they have new healthcare practitioners coming into their organisations, there's a lot of different people and business partners that they need to keep up to date with that. So, there's Services Australia, there's the pathology and diagnostics, there's quite often private health insurers. And so that anecdotal evidence that's been provided to us, largely from practice managers, has indicated that there's about 15 different organisations that they need to update every time they change their hours or get a new doctor or healthcare provider working in their business. And so Provider Connect is trying to solve that problem. If you think about it in terms of it would be your master data set and you update it and keep it up to date in that one central space, and then you can share it with all of your other business partners. So it is about maintaining that single source of truth of your details, and it's about having that one place to go to keep those details up to date. Provider Connect is also a really key piece of infrastructure in terms of the digital health interoperability plan. And over the next few years, you will see it become embedded in a lot of the digital health ecosystem. It's a really important piece of work because one of the things that Provider Connect does, it makes sure that accurate data is what's entering through that ecosystem. So I'll show you a slide in a little bit, but most of the information that's provided into Provider Connect actually gets validated against its original source. And the reason we do that is we want to make sure that it's accurate and correct information that flows through that whole digital health ecosystem. We want to make sure that business partners are getting, again, that full accurate picture. And it prevents things like privacy breaches because a business partner, has the wrong phone number or has the clinic that the doctor worked at 2 years ago. So the intention is to really build this up and make it that one place that everybody goes to get that single source of truth. And, the important part of this is around keeping it up to date. It establishes those unique identifiers as well for all areas of healthcare. So ensuring that those are readily identified and linked across the healthcare ecosystem. We've heard through the various conversations and peak bodies and healthcare providers that we've engaged with that there's a lot of challenges with our healthcare providers. And one of the things that Provider Connect Australia is trying to solve is just streamlining how your business partners get your details, and the fact that they can be absolutely sure that those details are accurate and they're coming direct from yourselves. So I'm sure it's not just me. I'm sure many of you get those various kind of scam text messages that fly around from time to time. Provider Connect Australia provides a really solid place so that business partners know that if they're getting any information about updating details, changing phone numbers, change of bank accounts, if it comes from Provider Connect Australia, it provides a really safe, secure way for them to get that information and know that it's coming from the correct source. So the other thing that Provider Connect does is that it links up to the National Health Services Directory. So it is a way for consumers to locate healthcare providers within their locale so that they can connect with the right healthcare provider for them. And so as part of Peter's demonstration, he's going to show you a little bit about National Health Services Directory and how the information flows from PCA into that services directory. Again, it can also connect up with online booking systems. We're doing a lot of work at the moment with private health insurers. So we've got a number of private health insurers that are in our test environment looking at how PCA works. They're quite keen to come on board as one of the business partners that you can share information with. So that's in the work. All of the primary health networks are already connected up to PCA. And so again, we would really encourage the PHNs to use PCA as the channel to get updated information from your healthcare providers. It also acts as a communication service. So with secure messaging and prescription exchanges. And so we already have a secure messaging provider, Foxo, who's connected up to Provider Connect Australia. And we're working across the landscape, linking in diagnostic services, public and private hospitals, and we've got a number of professional associations and peak bodies who are also coming on board as business partners. And if there are business partners that you deal with, that you need to keep your details up to date with, that's not on the list, then we would love to hear from you and find out who they are, because it's our role to bring on board those right business partners that make sense for you. So PCA actually started out in November 2022, and it was a response to the vaccination clinic finder. So, in COVID times, consumers were really keen on going to clinics, but there were certain vaccines that they were particularly interested in. And so PCA actually evolved out of trying to solve that problem. But since 2022, it's been progressing, and we've looked to expand the use of PCA because, at the central core of PCA, it's about having correct, complete, validated data flowing through the national health ecosystem. And so there was a pilot done, which was stage 1 with GPs and some community pharmacies. As part of stage 2, in the end of 2023, we've really focused in on allied health and bringing allied health on board into the Provider Connect Australia ecosystem. And so that's, one of the key reasons that we've been concentrating on engaging with private health insurers and allied health peak bodies in particular. Really where we are now, though, is looking to expand PCA further. So as I mentioned before, it's a really critical part of what is the foundational piece of our interoperability plan. So largely how PCA works is the healthcare organisation will come in and register. They'll enter their details. Those details will be validated against their source of truth. So, it'll be validated against the HI service. It'll be validated against APRA, Medicare information. And so that is just making sure, as I've said previously, that we have complete, accurate information flowing through this system. What's really important to understand is that as a healthcare provider organisation, you get to choose who you share this information with. And so whilst we've got business partners listed there on the right-hand side, it's the healthcare organisation that chooses whether or not that's a business partner they want to share their details with. So they are in complete control all the way through this. And the other key component of that is each business partner, as part of them coming on board to PCA, is that they will actually show the healthcare organisation what type of data they need and how they intend to use that data. And the healthcare organisation then accepts those terms and conditions. So we've made everything very transparent through this process. We absolutely recommend to everybody that, you know, they make the National Health Services Directory one of their key business partners, because it advertises your clinic and the services your clinic provides on that key directory service, and it makes it easier for consumers to find your service. Obviously, there's benefits here for healthcare providers. It reduces duplication. And so one of the things that business partners can do is use the information from PCA, if the healthcare organisation has signed up and said that it's okay to share it, to actually pre-populate any other forms or information that might need to be completed for the business partner. So it starts to streamline and build in some of the smarts around that form population. It saves time because you've got the one source of truth that you keep up to date with your key details. And then if there's any changes to that, rather than having to contact, you know, up to 15 different organisations to let them know of your changes, you just go into PCA and make sure that you're connected up to those business partners, and that information will flow straight through. And there's improved awareness. So as I mentioned, we've got a number of directories, not just the National Healthcare Services Directory, but Health Hunter is also now onboarded as a business partner, and they're also another directory. So different ways of sharing your business details. Business partner benefits. So the benefit for the business partners is that they get those timely notifications of any changes to details. There's a reduction in data entry errors because the information that they're getting is validated and it's complete. And as I mentioned before, you know, PCA supports the automated pre-filling of registration forms, which actually then streamlines the processes, not just from a healthcare organisation's perspective, but also from a business partner perspective. Now, if you do have a business partner in mind and you want to have a conversation with them, or you want us to have a conversation with them, it's really important, I think, to know that there's different ways that a business partner can connect into PCA and get that information. So the low-tech way of doing it is to simply just get an email notification of changes. So many of our PHNs have this as an option. So if a healthcare organisation goes in and updates their details, an email is just sent off to the business partner to let them know of that change, and that business partner will manually enter it into the system. And that kind of works for business partners who want to start using this straight away, or maybe they're just a small. For those that are kind of in the middle there, they can literally go into PCA at whatever interval they like, and just download any changes. So that some might want to do it daily, some might want to do it weekly, but they literally just download that information from PCA and upload it into their ICT system. For those larger organisations, and the one that we're, you know, really working to encourage, is full integration with PCA. And so that just means it all comes across in real time. It's connected directly into their system and the information just flows through. And the agency has developed a FHIR API to actually make that integration a lot quicker and a lot easier. The last thing I just wanted to mention to everybody before I pause for any questions and then hand over to Peter, we actually have a team that you can call at any time to support you through this process. So we've got the phone number there on the screen, which is the top phone number. So it's 02 6223 0741. And if you press option 3, that's for PCA, you will go through to someone in a matter of minutes. And those staff are there to help you through every part of the registration process. Peter is actually going to show you the registration process, so you'll see that it's not complex at all. But if you do need a hand, or if you get a bit stuck, we've got our staff on hand to help you. The other thing I'll throw in there, these staff are not just helping with PCA, they'll also help with your My Health Record registrations. So, they know quite a lot about the agency's digital products and can guide you through all of those processes. Okay. Any questions on the role of PCA and what it is that product can help you with? Nope. All right. Well, I'm going to pull down that slideshow and I'm going to hand over to Peter.
Well, I'm hoping that, hang on, let me see if I've got my mute off. Yes, I've got my mute off. Can you see the screen which says, welcome to Provider Connect Australia? Noting that I've only got 14 minutes left. So what I'll do is I'll focus more on the registration process and how to get in and out of it, and then I'll briefly show you the how to add a location, services, and the linking to Health Direct. So firstly, to get into PCA, you need to have a Proda account and you log into Proda, and then once you log into Proda, then you will be presented with the Proda screen, which give me a second to do my two-step verification. Just wait for that to come through. While I'm waiting for that to come through, I'll show you the launch screen of PCA. So this is the launch screen of PCA. I just want to show you that everything that Cheryl has said that I'm going to say can be found in these two links down here. This link here points you to the PCA website that's public available, and all the things that Cheryl said are shown here. So you can review this quite easily. And the other part, I'll get that out of the way. The other link is showing you everything that I'm going to tell you, these parts here. Read the pre-registration checklist, registration organization, and so everything is publicly available. You don't have to memorize everything I say now, but I'll get back to the login, and I've got my two-step verification. So everybody should have a Proda account. Oops, I must have typed it wrong. So whenever I help people register over the phone and I say log into Proda, for some reason they log into Proda and they click on HPOS and they go into HPOS. So no. Most people have never been all the way down to the bottom down here, and that's where PCA is. It's in alphabetical order. So to get into PCA, you just log into Proda and you click on PCA, and then you get the automatic PCA launch screen that I showed you before. Now, this is the first time you go into PCA, you'll see there's no organizations here, and it'll prompt you with a setup helper. So you can see there are 3 steps involved to register an organization. It's enter your organization details, sign and upload documents, and then finish the setup. The first one is pretty easy. The second one, signing upload documents, might be a little bit harder if you're not the right person and you don't have the correct director handy. The third step is pretty easy, and using it is pretty easy once you've seen it. So what I'll do is now I'll just go back to this is my live environment. So I'll go back to my training environment now, which is it's under that button there. There we go. So unfortunately, my training environment has a lot of test information, and he say ignore that. And so when you want to create an organization, you'll be presented with the add organization button, like I showed you before. And then the first step was enter your organization details. Now I'll go slowly through this because this is important to get it right the first time round. A lot of problems we have when we have calls is people didn't enter the details properly. So obviously this pre-fills information that you have in your Proda account, and sometimes people click on that button there. You only click on that button there which says I am a sole trader without an ABN, only if you are a sole trader without an ABN. So typically you type in your ABN number, and I'm just going to grab a random ABN number from a random site just to show you what it does. Oh, why is it always under that button there? So there we go. And then you click on lookup. When you click on lookup, it's going to, oh, maybe it's the spaces. Oh, maybe it's already in here because I've used that as my test organization. Okay, is that what it said? Yeah, it's already registered. So let me pick up a different random organization. I don't know. Just anything will do. So, unfortunately, this is a random pharmacy I've picked, happens to be Roller Knives Proprietary Limited. It pre-fills information for you. You simply enter the business's phone number, you enter the business's email, and you really just type, this is the postal address, you type in the address or website, all these things, and then you click on Add Organization. Then it pops up the Setup Helper again, and it shows you've finished the first step. So as long as you've done the first step properly, then the next step shouldn't be that hard. So I will flow into the next step. And so the next step gives you some choices. If you're not the right person, you want somebody else to do this for you, like a director, then you copy this link and you send it to the director. But I'll show you the easiest path forward, and that will be I'll be signing a participation agreement because there's two documents you need. You need the participation agreement and some evidence to prove that you have rights to commit to this ABN. So I'll be signing this participation agreement, and I'll say I'm a director, and I'm going to, it'll give you evidence of authority. You either upload an ASIC document or some other evidence that it can find you that proves that you're a director, or you say I'm going to do a stat deck. The stat deck is probably the easiest way out. So whatever you type in down here, it'll pre-fill it for you in the stat deck. So you don't have to write a brand new stat deck. All you've got to do is make sure the information is correct. You save it, and then it says you got to download to sign it. So I'll show you the downloading to sign stat deck shortly, but I'll do the participation agreement first. Now you can see there's two choices here. You can either download the participation agreement, or you can electronically sign it. I will show you the electronic sign one because it only takes like a few seconds. So we still have plenty of time. So electronically signing, you wait for the screen to draw. Some people go through this too quick and they click on the close button too early. And you don't touch this password here because that button there tells you to copy the password. So you click on copy password, you wait 5 seconds, and then it'll show you where to paste it. I have had people click the close button before the paste appears. You paste the password in, you click continue, and Adobe is now taking over. You just follow the instructions on here. You click on start, you click on sign, it pre-fills your name for you. You click on apply, and then you say sign the document, and you're all set. So that's a participation agreement done. So that barely took seconds. Okay, so then you click on close, and I have sometimes where it says Adobe refuses to proceed, but you just ignore that because it actually does work. So you'll see now the participation agreement is now ticked off down here. So it says signed. Now we need to do the stat deck. So we'll download the stat deck. And so that's the stat deck for you. It's pre-filled it for you. You can see this is the instruction page on the stat deck. And then you can see this is the first actual page of stat deck. It's pre-filled my position and name. And all I've got to do is print it and get one of these people here to sign it with me. Like if you're a pharmacy, then you'll just get a pharmacist who's working at the pharmacy with you, or a nurse or somebody if you're a medical center. So that's quite an easy pathway as well. So then all you do is you go back to PCA once you've done your document there. Get this thing out of the way. There. The sharing thing's right over the button I want to click. So then all you do is you just browse for a file and you upload the stat deck. You upload the stat deck. And basically you have the 2 ticks. You submit for assessment, and then our people will then check to make sure you've done it correctly. And it says here it takes 24 to 48 hours to get the approval. That means business hours. So therefore, that is the registration process done. I'm hoping that I didn't go too fast through that. Now, the main point is you really need to answer those questions carefully. Now, what I want to do now is I want to go to a system, assuming that we've already got it approved. And now I want to go to a real site, organizations, and I've got a couple of pre-made ones here that I want to play with. One say called My Health Sydney CBD. It's just a made-up training system. And as you can see here, once you get approved, you will definitely see the word PO, which means participating organization, and the name of the entity that the ABN that you put in. And under it, you add some locations. The teardrop ones are locations. And so for each location, you add a healthcare service. Okay. And then the healthcare services will appear. And if the healthcare service needs a particular practitioner added to it, you just click add practitioner. So what I'll do is I'll say, for example, like say Telegraph Road, we'll add a healthcare service to Telegraph Road. And it shows you on the screen here the top most popular ones. And let's say we add physiotherapy service. There's only about 5 questions you need to answer that are mandatory. The rest are optional. This is quite a good spot here to add extra information in that you want to show to the public that this particular service does. So you can type in more information here. That's free text format. But otherwise, down here, these yellow boxes are important that you can read later on. But the service operation date, it defaults to being active, so you don't have to say pick a date unless you're saying going to run a COVID clinic like in September. So then you type in the September dates, and then that would publish correctly for the September dates. This billing options says it's got an asterisk next to it, so that's mandatory. So you probably pick fees apply or whatever's appropriate for that service. Languages, you choose the languages that's you have at your site. There's quite a lot of languages here. If you scroll down, you'll see there's plenty. Probably way too many. Appointments, if you leave it as unknown, it just uses your own booking system, but otherwise you can just say yes, appointments are required or not. And this is all going to get published. New patient bookings, yes, we accept new patients, or we overloaded, we can't accept more. Special conditions, IAR is for mental health care support, so people who understand IAR will know what to put there. And then down here, it's asking you, this service needs to have an address, but typically we're going to say it's going to be at the same address as the practice. So we'll just click on the use these details, so you don't have to retype that in. And it's the same with all these details. Now, I wish to publish availability for this service. So what I recommend you do is for the practice, there is one service called like general practice service. That's where you put the availability for the whole general practice. But if you want to narrow it down just for this service to have less availability, then you can type in the hours of availability for the service. So what I recommend for most services other than the core one, you just go, I don't wish to publish the availability. This is not saying publish the information, but just the availability of the service. But just quickly, I'll just show you how you want to put the trading hours in. So to put the trading hours in, you click on add normal operating hours. You say pick the days that you're going to run this service on. So this say it's only a Monday, Tuesday, Wednesday service. You say we're only going to run this service from say 9 a.m. to, I don't know, 1 p.m. because it's a shorter service. And then you click on the add down the bottom here. And you can see it's showing the operating hours for that particular service. Now, notice I'm running out of time, so I'm going to quickly, I've only got 2 minutes left. I like to keep to the time. So then all you do, then you come down the bottom, you say, I want to publish to the, for consumers to see this information and for other healthcare providers to see the information to NHSD, and you go add healthcare service, and that service has now appeared in that organization. Now I'll just scroll down the organization. Sorry, because it's so busy, I've got so many organizations here. You'll now see that physiotherapy service has been added. Now notice I'm running out of time. So you can add a practitioner in. You add a practitioner in based on the ARPA number, and you search for it and you add them in. So what I want to do is show you, for example, like there's a business here called Telegraph Road, and you can see it's just a blank one, but I want to use the Telegraph Road one as an example. So all this information here, the contact details is what you've put into PCA and it publishes it. So if any of these details are wrong, you go back into PCA, you edit your own business. The trading hours, you edit your own business. The availability of the facilities at the service. This is the things that we just saw a minute ago. Billing options and practitioners. You can see this particular site has many practitioners. You can add or remove them quite quickly. And it updates this website within 3 hours because it's the FHIR interface, and also it shows a couple of services at this particular site. So you can add more and more services. Mostly services, practices have more than those two services. I've put in some practices, and they came up with like 30 services, and they didn't. Even some pharmacies came up with 20 services. So noticing that my time has run out, I better cut this short. Is there any questions? And this was me being gentle, okay?
Love to hear your wonderful summary again.
Summary, again, remember the key information is you get into Proda, go down to the bottom, PCA is down the bottom there, you click on that and it'll prompt you with the, if you're a first time user, it'll prompt you with, if you've never been to PCA ever, it'll just say there's missing information. It'll say, I'm missing an email and a phone number. That's the first thing it'll do. So you put in the email and phone number, then it'll prompt you to screen with the add organization. The add organization is you just simply type in the ABN, do the lookup and check the information is correct. Then the two documents you need to sign or fill in is the participation agreement and an ASIC document or a stat deck. Okay, some people have the partnership agreement at hand, but usually the stat deck is easier because in a practice or a pharmacy, you've got a printer there, you just press print, you walk it to the director, say sign this, and then you scan it and upload it. So either way, it's pretty quick and easy. And once the document goes to our end, we can get people to check it pretty quickly. So call us and we'll walk you through all the steps. So anybody has any questions, call us based on the number that Cheryl gave, and we're all ready to help you out. This is not just a call center. It's we have about 9 people who will answer the phone quickly and bounce it on to one of the people, including me, to help you out.
Thank you.